Welcome back to Face to Face. I'm John Ralston. We're talking about the regulation of medical assistants and Botox with a prominent plastic surgeon who's joining us today on the program. We talked to a couple other doctors, as you know, and I mentioned earlier about this. There's this trade-off, I think, between medicine and commerce, and Louis Ling, the executive director, talked about that, throwing these medical spas, just making it seem like they just care about making money, and that no doctor ever cares about making money. Which, of course, you know, no, I'm being facetious, but no one buys that either. Sure. But I want to show you what a couple of doctors, Dr. Julio Garcia and Dr. Gary Lee, had said over this. Then I want to show you something that you said to my producer about a year ago about this.
Then there's this quasi-restriction of trade. A person's a physician. How can you tell me what I can and cannot do?
We're starting to go into an area where other people feel that is proprietary. And our position is, well, we can put in a spinal tap on somebody legally, or if we can put in a central line legally, you know, what's with the Botox needle? I don't get it.
And as I said, as long ago as a year ago, you talked to my producer, Dana Gentry, about this. And let me show you what you had to say.
I think it's wrong that you have a pediatrician that is overseeing a medical spa. And maybe they've gone to a weekend course.
So in other words, it is a little bit more complicated than just taking a few courses to stick a needle in someone's face, right?
Absolutely. If you think about it, if somebody wants to focus their practice, such as Dr. Lee did, and decide that that's what they want to do and become very good at it, and from what I hear, he's excellent.
He seemed pretty diligent to me. I mean, I don't know anything about this, about his practice, but he seemed pretty diligent in preparing for it.
And I've heard that from other people as well. So I think that for somebody who chooses to do that and to provide great patient care in a safe setting, I think that that's perfect. And I can't give you case examples, but for when you've got a medi-spa and their medical director is someone who's not on site, someone who doesn't in their primary practice do these things, I think that that's not the person that should be overseeing somebody. What if there was a complication? That person, that medical director, has ultimate responsibility to take care of that complication or recognize it. And so that was the point that I made in that earlier comment.
And let me make sure I understand what you're saying. You think that someone, as you do in your practice, should be sitting there with an MD saying, when the patient comes through the door, say, listen, this is pretty safe. There's almost nothing bad that can happen. But you know what? You should know about these complications that could arise before you go in. And you don't think a lot of patients are hearing that at these medical spas?
It's been my experience that that's the case. I can just think of patient after patient who have told me that they'd never heard that their eyelid could droop. They'd never heard that there could be bruising. They'd never heard how long it takes for the effect to come on, how long it lasts, all those things. They tell me that by the time I get them up into the exam chair to examine them and talk about the treatment, they've already been treated and out the door in some places.
That's kind of scary. In fact, Dr. Garcia told Dana about the temptation to pump up the bottom line at these places. Here's what he said. I guess we don't have that, but basically what he said is, I'll just read what he said. Some of the spas, some of the doctor's offices don't do the procedures properly. They might do the injection procedure correctly, but then they don't use and store medications properly. It becomes a profit-driven issue. The greater the percentage of your total income comes from that, the more willing you are going to be to protect that. You think that's right?
Sure. I think that you said it before, and it is about money. I mean, it's about delivering proper care to the patients, but when you see somebody who's trying to get somebody in and out of the door in 10 minutes so they can get the next person in the seat, that's not about patient safety. That's about generating money. And so I think that there are a number of things. Patients, they have a responsibility to themselves to get to know about where they're going, who's treating them, what's the product, is it an FDA-approved product? I mean, there are dozens of questions to ask that they should know before they have treatment. And
I don't know if this is an appropriate analogy or not, but I'm sure you'll tell me if it's not. But what you're describing, this kind of assembly line medicine that's going on, is essentially what the endoscopy center was accused of too. Too much volume, not paying enough attention. That was overseen by doctors, right?
Well, you know much more about that than I do, and I've not read the complaints. I've just seen what's been on the news, and that's, as you know, still being investigated. And I'll have to see when it comes out. And it appears that that could be very true.
So what do you think about this regulation? I want to wrap it up with this. We have about 30 seconds left. What do you think about this regulation that they're going to propose on Friday, which essentially would prevent medical assistants from doing anything but, I think, the most simple kinds of things like vaccinations?
I think that that's going to help, especially as, in this time of when the flu is coming and you've got a busy pediatrician that's seeing many patients. For them to be the ones that have to give the vaccination or hire a nurse to do so would be cumbersome, but nonetheless, as I said before, safety is important. I think that overall, what it's going to do is provide clarity to the providers. It hopefully will provide clarity to the patients in town, and really, people really deserve it or owe it to themselves to educate themselves before they go and have something done. You may think of it as something as simple as a Botox, but you do more research going to buy a car than you decide who's going to do a medical treatment on you.
And that's great advice for patients. Doctor, I really appreciate your willingness to come on and talk about this issue. Thanks.
My pleasure.
All right. If you want to contact me, you can email me at ralston@vegas.com or call me at 650-1976. You can also go to lasvegassun.com, click on my page for the program schedule, links to the program, my columns, and Dana Gentry's blog, The Final Take. You can also download the program straight to your iPod by subscribing to the free Face-to-Face podcast on iTunes. And now, go face to Facebook. Check out our video links, see a schedule of upcoming programs, and post your own photos and more. Just search for Face-to-Face with John Ralston. Now, on the next Face-to-Face, Brian Sandoval is getting off the federal bench. But guess where he's going right away? He's coming on Face-to-Face to announce his run for governor.